Natalia Wafula. I'm currently a medical student at the University of Nairobi. My organization is called Mind Africa. We're currently based at the University of Nairobi Medical School. So the organization was started in January 2022. And what we do is basically raise awareness about various diseases, but we've mostly been focusing on blood diseases such as sickle cell disease, and we try raise awareness about this to patients and their mothers, because mothers usually are the ones who are taking most care of the sickle cell disease patients. We've also been trying to raise awareness around hemophilia to both patients and their parents, most of whom are mothers, as well as breast cancer and cervical cancer. So my motivation to start Mind Africa came about when I was doing my electives over the holiday at one of the hospitals around home. So during this period, I happened to rotate in two of my favorite departments, that's pediatrics and oncology. So in pediatrics, we saw many of the patients, but those that touched me the most were sickle cell disease patients. So it just happened that I was rotating around July. It was really cold, and most of the patients who are getting were having sickle cell crisis, the pain crisis, acute chest syndrome and all that, and they were really in a lot of pain. You'd walk into a ward and find the children really crying, and it used to touch my heart so much, and I felt like I needed to do something extra. Now that was on the side of the patients. The parents who are accompanying these children, most of whom were their mothers, were really depressed. Imagine being in a ward with your child, seeing them cry like almost all day, almost all night. They're being given a lot of drugs and a lot of strong painkillers such as morphine, just to contain their pain. And I used to see that they were like really depressed, and just aside from seeing what kind of pain the children were going through, they were also being faced with a lot of stigma from the community and being blamed for actually being responsible for their children having sickle cell disease. So I felt that there was a bit of a knowledge gap surrounding this disease, and that needed to be addressed. So I had the idea of pulling some of my friends together so that we try create visuals and videos and just talks to educate these parents, their children, and the general public about sickle cell, how to take care of their patients, what diet they can do, just encourage them to adhere to medication so that we reduce the incidence of this crisis. Yeah, at the same time I rotated in oncology, and most of the patients had breast cancer and cervical cancer. Again, they were going through a lot of pain, a lot of stigma, and just that necessitated the need for me to try create awareness around these conditions. The beneficiaries of my organization are mostly sickle cell disease patients, their parents, but mostly mothers because they're the ones who are accompanying them the most, and then breast, cervical cancer disease patients, and just the general public who are interested to know about blood diseases. I have impacted 250 individuals through our outreaches, distribution of brochures around various health conditions, talks, and online campaigns to create awareness around sickle cell and cancer. My most inspiring success story so far was the sickle cell disease fund day that we did at Webuye County Hospital. So the aim of this was to create awareness around sickle cell disease and just to make the patients and their parents feel loved and cherished despite the challenges that they go through. So we the Webuye County Hospital had a clinic, so we invited all the clinic members to come on a Saturday, and then we had games. But what we did was to prepare handmade cards with, inspiring messages to encourage the patients and their parents to, just keep moving on despite the challenges. And we, at the same time, we're also trying to raise funds for, families that are not so well off to be able to take care of their patients' bills, because the sickle cell patients have to be on drugs like on a daily basis. So after making the cards, we tried selling them to the general public at a small fee of 100 shillings. So we made around 100 cards and collected a total of 10,000. And so we deposited this money in NHIF accounts for these sickle cell disease patients. So we played games, we listened to their stories, encouraged them, gave them gifts and those cards. And at the end of the day, you could see the smiles in the face of the patients and their parents, and that was really inspiring and insightful. Most of the challenges that we face is the fact that we are dealing with medical information, and so we really have to be keen about whatever we are telling the general public, because we do not want to mislead them. As well, funding of some of these initiatives is always a challenge, because sometimes you go creating awareness maybe about sickle cell disease or cancer and telling the patients how they're supposed to take such and such a diet, or how they're supposed to adhere to their medication. But even as you do that, some of them really come from humble backgrounds and cannot afford the medication or the diet that you're trying to prescribe to them. And so it becomes a challenge, because sometimes you tell them what to do, but you're not really supporting them in, financially to be able to achieve this. We have tried adapting to these challenges. So the one on being keen and accurate about the information that you're passing across to the public, we have a really rigorous recruitment process into our team. So mostly we've just been dealing with medical students, because at least they have background information. And then after we've created this maybe awareness videos or brochures, we have to run them by our medical doctors and just ensure that the content is valid as well. We do a lot of prior research on various issues surrounding sickle cell disease and cancer, so that we're sure we're actually telling people what is correct. On matters funding, we have tried to come up with innovative solutions to generate a bit of income. So for example, making the cards and selling them to the general public and getting a bit of cash to support the initiatives. As well, we have tried partnering with non-governmental organizations and hospitals to help us raise cash to support these patients. So we always try to write our proposals really well, do prior research, and just do a good job at convincing funders. Our initiative aligns with the International Women's Day's theme of inspiring inclusion by just helping these sickle cell disease parents, most of whom are mothers, to take more control over their patient's course of illness. So we've provided them with adequate information and education around what sickle cell disease is, how it's caused genetically, so that they're not taken aback by the myth that they're the ones solely responsible for this. And we've also, given them enough training and education on how to take care of their patients, how to structure their diets, how to give them medication and ensure that they're not relapsing. As well, we have tried to recruit more female students and doctors to create awareness around breast cancer and cervical cancer, so that the information to our patients and beneficiaries comes from a more relatable platform, because these are ladies who understand exactly how their feminine